You want us to mute or you want us to stay there?
Nah, you're straight. Hey, my name is Andrew, and today I'm going to be talking about Medicaid and more specifically advocating for Medicaid expansion in the state of South Carolina. So, first, we need to talk about what Medicaid is exactly. And it's the main program that provides health care coverage and long-term services for low-income households in the United States. And it's financed jointly by the federal and the state government, but each state administers it their own separate way. They just have to follow some federal guidelines. And Medicaid expansion started in 2014, and it means that the eligibility requirements to participate in Medicaid were expanded. And it came through the passing of the Affordable Care Act by the federal government, which gave states the option to expand their eligibility requirements, and they'd get matching funds from the federal government. So when it took place in 2014, only 26 of the states in DC elected to expand their Medicaid. But as of July 2023, there's 38 states in DC that have expanded. And according to healthinsurance.org, before Medicaid expansion, you were eligible for Medicaid if your income matched or was below the federal poverty level. So the Medicaid expansion made it possible for adults under 65 with incomes up to 138% of the poverty level eligible for Medicaid. So, for example, the federal poverty level for a household of four is 30,000. And before expansion, you'd only be eligible for Medicaid if your household made $30,000 or less. But with Medicaid expansion, that family of four can be eligible for Medicaid if they make $41,400 or less. And according to the Kaiser Family Foundation, South Carolina and nine other states haven't passed yet, and two states are currently working on legislation and or passing budgets allowing expansion. And that's basically what Medicaid and Medicaid expansion is. But you also have to understand what the insurance marketplace is, as well as the coverage gap. So the insurance marketplace is basically just run by a service run by the federal government, and it helps people compare insurance plans for coverage and affordability, and then they can enroll in a health insurance plan and then determine if they're eligible for tax benefits related to the plan. So a lot of people sign up for insurance through their employer, but the marketplace is important because some employers don't offer insurance. So if that's the case, then you can just go there. And there's a federal marketplace, but some states, not all, offer a state marketplace with the same types of information. And then the coverage gap, according to the Kaiser Family Foundation, is the existing states that haven't adopted the Affordable Care Act's Medicaid expansion. So, an individual or family, they're in the coverage gap if they don't meet the income requirements for their state's Medicaid, but they make too much to qualify for the marketplace. So, overall, in the US, there's an estimated 1.9 million individuals in the coverage gap, with 94,000 being in South Carolina. And as a result of South Carolina and other states not expanding on their Medicaid, they have and uninsured rates doubled in some states that have expanded on Medicaid. And frequently the eligibility levels in these states is very low because even though people may still be working, it's sometimes low wage jobs like in the service industry or in the retail industry. And even part-time work can disqualify you from being eligible for Medicaid. And the Kaiser Family Foundation estimates that if all states expanded on Medicaid, some 3.5 million more adults would become insured. And that's the 1.9 million that fall into the coverage gap and the 1.6 that are in the marketplace. And South Carolina specifically, if they expanded, there would be 166 more thousand more adults insured total. The 94,000 in the coverage gap, and then the additional 72,000 people that are eligible for the marketplace but aren't currently enrolled. So it may seem like they should do it, but the according to the Greenville News, the federal governors or government covers 70% of the cost for the people who qualify, and the state does 30. But in the expansion, the federal government would cover 90%, and the state would only have to pay 10% of the insurances. And the state already spends 25% of its funds on Medicaid, and the governor has said that they can't afford the cost due to expand or the cost of expansion. And that's because after 2 years, that 90-10 split goes back to the 70-30 that it is currently. But if Medicaid was expanded, then the cost of expansion would be funded by the money they're saving by people that are uninsured going to hospital visits, and then the government having to pay for that because they can't afford it. So, yeah. You guys have any questions or anything?
I'll ask you the first question. How would the proposed policy affect the budget for South Carolina?
Um, like I said, a lot of the budget they spend a lot on the 25% already on healthcare, and a lot of uninsured people go into the hospitals. And then because if you go there, it's not like and don't have insurance, it's not like they're not going to help you. But then after a while, if they just keep billing you and you don't pay, then the federal government has to pay for it. But with the expansion, these people would be eligible to go in and their insurances could cover it. Yeah, that makes sense. Any other questions? No, no. All right. Well, thank you guys for listening.